Thank you very much, panel, for your input. Now it's time to hear from some people in our audience.
I'm Art Kennedy. I'm a caregiver for my wife. She developed Alzheimer's about 5 years ago. I was also the caregiver for the congressman's mother along with another young lady before she passed. And the only way I'm able to survive as a caregiver is the congressman told me once I explained the situation to my wife that he didn't care if I ever went to work. You take care of your wife, we'll take care of the office. So I sympathize with those people who don't have that kind of leeway to do the things that I have to do with my wife. We have 6 children, 19 grandchildren, and they just cannot deal with it. They cannot see their mother or grandmother like that. So it falls on me and 3 other caregivers that I have. Then I ran into a problem with the government. Pay the ladies $20 an hour, and they're telling me I have to take out withholding, Medicare, and all that. I said, I tell you in IRS what, y'all can take it and go. I'm doing what I need to do to take care of my wife. I'll deal with you all later. End of story. Thank you.
Hi, my name is Laura Jones, and I am caregiver for my husband, who was diagnosed with Alzheimer's 5 years ago at age 50 when our daughter was 3. And I'm actually really grateful for everyone to be here. I'm very grateful for this law. The biggest challenge for me is my daily life. Finding someone to take care of my husband and finding someone to take care of my daughter while I work. It's a terrible, terrible disease. I think that we need to do something to help the younger people in this country. I believe that as we become more aware of this disease, that there will be more people diagnosed who are younger and more people admitting it. So, you know, I think also we need to break the age floors on some of the services. We have actually applied for some services and been denied because my husband isn't 60 years old yet. That's absurd. We all know that there are people in their 30s, 40s, 50s with Alzheimer's. So, just to paraphrase, I'm hoping that the government will take a good, solid look at the people who are younger and their families and what this impact means to the caregivers, and I'm including my 8-year-old daughter as a caregiver.
Hi, my name is Kathy Kalk. I'm here today because I have worked with the Alzheimer's Association for over 15 years. My concern is the caregivers. Last year alone, the caregivers in this country saved $202 billion from the federal government. They saved because they took care of their loved ones. There is no rest for them, and they do not have the avenues to be able to get a rest and to get a chance to rejuvenate themselves. I see this every day. Caregivers, last night I was on the telephone with a caregiver for 2 hours who cannot take care of their father and don't know what to do and is distraught and has to lose their job over this. We need our Congress people to get together for a change and to make a difference in these caregivers' lives, because they need us. They are there, and they saved us $202 billion. And so it's our job to make sure they get the care that they need. Thank you.
Yes, my name is Tony Friggles, and I'm here today because of my wife. She was diagnosed with Alzheimer's at age 55, and this was 6 years ago. So for the last 6 years, we have been on an uncharted journey trying to cope with the challenges that this disease has brought to our home. We both were forced to retire and face the daily ordinary life. My biggest frustration during this last 4 or 5 years that I have been involved with the association is my perception of the lack of sense of urgency in getting things done. For instance, we are happy that this law was finally signed, but it took 4 years to get it signed, and here we are still trying to get input from the public as to what are we going to do with this law. So this may take another year before it gets implemented. we all know that there is a quick solution to this problem, and it's called money. We know that this nation has faced many other challenges in trying to eradicate other diseases, like polio. In 18 months, they got rid of polio. You mentioned HIV before, and you know there was a presidential emergency plan relief for AIDS, and in 14 months, they got from someplace $43 billion for AIDS. Now, Alzheimer's is only receiving $450 million for research and development, when it's costing Medicare and Medicaid $130 billion. So anyone in Washington just trying to find return on investment will be wise to allocate more money. You know, we're only $50 billion away from a cure. So my call to people in Washington and to people in Chicago in the Alzheimer's and to all the people throughout the United States is to raise your voices so we could finally find a cure for Alzheimer's.
Hi, my name is Lily Q. Odom. I have two sisters that I lost to Alzheimer's for one and dementia to the other. And I also work for the City of Miami Gardens in community outreach, where I have been around families that have members who have Alzheimer's. And I think that the biggest problem we have, along, of course, with money, is awareness. Many of our families and caretakers want to hide their family members. So I've been very impressed with Russ today because he's out and the awareness is there. But I think that what we need to do is work a little more on getting awareness for the families and the caretakers so that they are not afraid to let their family members come out and be seen and learn a lot more about the disease, because it is a debilitating disease. And the more awareness that we have, I think that folks will be mindful of it and that they will be glad to let their family members come out and learn a lot more about the disease. So I think awareness is really, really important.
My name is Norma Trabanco. I'm an educator in this community for Alzheimer's Association. I've been a volunteer for 23 years and presently the co-chairman of the Memory Walk. I wanted to mention something that Tony and everybody else has said here before. I was a caregiver myself, and I continue to be one. And it's pathetic that we don't have one single penny to help the families who are suffering every single day to take care of their loved ones. Thank you for your time.
Congressman Deutsch, your reaction to this heavy stuff?
Well, excuse me, it is heavy stuff, but it's particularly heavy for the folks who are dealing with this every day. We, by having the opportunity to hear from caregivers and people who are suffering with Alzheimer's, Dr. Vance is doing such great work. There is, I think, an opportunity that this presents, an opportunity for Congress, an opportunity for the nation to dedicate itself to tackling this issue. We can make great strides. That's clear. I mean, there is, with an investment of research dollars from the federal government, that money can be leveraged with money coming from the university, from the private sector, from others who recognize the opportunities that exist with the right research. And at the same time, we can't, even as we're focusing on Alzheimer's patients, we have to recognize the great strain that caregivers have. And look, Julia's point, if there's one thing that we can do right now, and I know Julia's made the point, and I'm going to make it again, encouraging people to sign a durable power of attorney in healthcare surrogate form is easy. And if people find themselves in this position in the future, it's a very significant step to help make life better, both for the patient and for the caregiver. There's a lot that we can do. We just have to focus on it, and there's got to be an understanding that this is in everyone's best interest. This is not just some small group. The impact on all of us is so significant.
Okay. And now here's a sample of what the Southeast chapter received online through email, YouTube, and Facebook. My biggest concern to be addressed through NAPA is caregiver stress and health. My cousin's been caregiving for her mother for 5 years. During that time, my cousin got ill and was hospitalized herself due to stress and ignoring her own health. Many people are the sole 24/7 caregiver and have no relief. Funding and availability of adult day programs are constantly being cut, leaving no option for family caregivers. Increased funding for respite and daycare will improve the quality of life for both the person with Alzheimer's and the caregiver. Please consider both parties while implementing this important law. Thank you, Barbara Canavan, Lake Worth, Florida. And here's one from a former caregiver. Finding a cure is the most important priority for NAPA. I also want the U.S. Congress to invest the proper funding in research and preventative measures and the connection between alcohol, stress, and smoking on Alzheimer's. I have a large family and fear these issues, along with hereditary factors, will affect the number of us who develop Alzheimer's. Alzheimer's will devastate my family and the country if we do not find a cure. Thank you, Joyce Borg, Harahan, Louisiana. Here's one concerned with training. Medical staffs working with Alzheimer's patients need more specialized training to properly deal with the various mood changes and unstable behavior of someone suffering from Alzheimer's. Compassion and understanding are essential. Tom Ellick from Oakland Park, Florida. And finally, this gentleman writes, I'd like to see the nursing home and Medicaid qualification process be streamlined. Nursing home attendants, aides, and nurses provided the requisite screening, selection, and training so they can appropriately manage and care for Alzheimer's patients. And funding directed to research institutions not tied to the pharmaceutical industry. In the case of my father, the process took over 6 months while going back and forth with various case managers, nursing home visits, and interviews in our quest for a facility that could appropriately manage him. My father was denied at 3 facilities for lack of space and illness-induced aggression, so he was placed on a waiting list and his condition deteriorated. My mother, under great distress, had to care for him, averaging less than 3.5 hours of sleep a night. My father was eventually placed in a nursing home, but to our surprise, the facility did not have the appropriate talent to manage him. The most blaring case was finding his medication on the floor, the medication that aides were there to ensure he got. It is a painful process to leave a loved one in a nursing home. Let's not further compound it with facilities that are not prepared to handle such cases. Elias Jimenez from Miami Beach, Florida. Thank you all for your input. As you heard here today, everybody has heartbreaking stories of how Alzheimer's has affected them and somebody they loved. And my heart was broken in 1987. I was just 8 years old. My grandfather had Alzheimer's for 6 years, and he boarded a bus, went for a walk, boarded a bus, rode the bus to the end of the line. And when the bus got to the end of the line, he went for another walk, and he was really far from home, at least 10 miles. He got out of that bus in the middle of winter in Lowell, Massachusetts, and went for a walk and decided to lie down, and he died. There was a 10-day search for his body. They didn't know where he was. He laid down in the snow, and he was buried by snow, and so it took him 10 days to find him. The National Guard was involved in the search, police. It was the top story on the news for 10 days, and they finally found his body there in Lowell, Massachusetts, far away. And that's when my heart was broken by this terrible disease. I've known about it my whole life, but I can't say the same for the youth of America. So that's what this whole point is. Let's get awareness. Let's find a cure. Let's find treatments so the suffering can end. I thank you for listening and thank you for supporting Alzheimer's. To sign up to become a local advocate, please go to the Southeast Florida chapter website. It's www.alz.org/SE-Florida. I'm WPLG's Jason Martinez. Have your voice heard. Stay in touch.